She done?
No, I got the blender. I'm gonna have it delivered to my brother's place.
Oh, the blender was for Mother's Day.
No, the juicer was for Mother's Day.
Oh, okay.
So now she's got a juicer and a blender.
Appliance.
Hello. And there's I don't know when she finds the space, but you know what?
Hello and welcome to ProPod, where we begin professionally and see how it goes. Okay, today we're joined by Candice and Donato.
Yeah.
Today we'll be talking about the artistry in dentistry and occupational therapy. And here we'll go with the first segment. We're going to be discussing the artistic elements in dentistry and OT, cosmetic dentistry and prosthesis. That's what we'll be talking about as dentists. And occupational therapy, we're talking about
Creativity.
yes.
Yeah.
So especially now when it comes to cosmetic dentistry and prosthesis. Prosthesis is, first of all, I think is the worst part and also the easiest part, and that's crown and bridge. Yeah, I think it's first of all, I think it's easy because we don't necessarily have to focus more on that because it's mostly lab work.
Yeah, true.
So we just have to do the preparation using the sciences behind it and then send it off to the lab. I have been through labs. That's why I know it's lab work. Sometimes you do the best and it comes out looking like that's the way to
Yeah. But I think my experience with prosthesis is like wholly undergrad. So that's why I still have PTSD from like 4 folds. Oh god. Friday night at 7 o'clock and you have to reset up because anyway, good times of food. Bloody hell, those people like.
So basically in university, what happened was
Is prosthesis like dentures?
yes,
That's part of it.
It's part
dentures,
of it.
false teeth. Basically, false teeth are fixed or removable. So we've got the ones where if it's fixed, it is either attached to another tooth, like a bridge, which is replacing the missing tooth,
Okay.
or it is a crown. Say, for instance, the tooth is broken down and you want to fix it in such a way that it is having an extra coronal morphology. So it sits on top of the prepared tooth. Then you've got the removable dentures, which is the false teeth that you place in and out whenever you want to.
Yeah.
With the suction sound.
And implants and
Yes, and implants also the fixed one. But implant is one of those ones that will need other things to be in place before it can be put in. So you need bone augmentation sometimes, proper gum contouring as well. So it's not one of those that is considered generally as anybody can get it because you need to meet specific requirements before you can actually get an implant. If not, it will fail.
and it feels spectacularly.
Yeah, there's a condition implantitis, but we are not talking about
That
we're
right
not going to go deep into any of the things. Okay, so some of the aspects in artistry is where we're obviously looking at the proportions that needs to be cut in. Say, for instance, we're doing veneers. Specific amounts of the teeth has to be shaded or cut through before going through. If we go too deep, obviously going to the pulp chamber, and it's another problem. But now, also speaking of that, when we're doing the false teeth, we still now need to take into consideration the shade. So you're now replacing a tooth. You don't want it to look like it is not natural.
You should make it yellow.
Or if the person's natural shade is yellow, or if after discussing with the patient you want to make it have a yellowish tint, yes. But we've got a shade guide that we go through. Also, when we do these things, yeah,
we're guessing. No, we have to like look at the person's features and try and match the color because you don't want it to look like, you know, those toy things because then people be like, that's fake. You want it to look as natural as possible.
Or they want it to be porcelain-like and it just looks like the base of the toilet. It shouldn't.
Yeah.
But some people want that. So if you're going for that, that's when
we have to discuss.
Yeah, then that becomes a different thing. But different people want different things. You explain as an OT the creative aspect of it and how it plays a role in life.
So I thought that was very interesting. that you chose like creativity in OT? Because it could mean, well, it could be like two aspects of it. Because OT we use activities when we do our interventions. So it could either be that your activity is creative, like arts and crafts, or it could just be in how you structure your intervention, and that's like what makes it creative. Because everyone has like their own, like you as a therapist, you have your go-to techniques and your go-to activities. So that was very interesting. Our setting where obviously resources are very limited, you are forced to be creative in your intervention. So a lot of the times what you do, you just go based on, okay, if this is my aim and my objective for the session is this and this, how am I going to reach it based on what resources I have? So then you have to be, yeah, you have to be flexible. You have to be flexible. And activities will never, or it usually doesn't look the same for each person. Yeah, very idiosyncratic.
Okay.
Yeah.
Well, I think that, you know what, let me not add on to that in terms of working in public or private. We'll get to that in another segment. Question, another one is on the science behind a smile. So we just need to discuss the scientific principles behind some dental procedures and oral health. With this one, some people think dentistry is just about you go to the dentist and they look in your mouth and we just say,
Brush your teeth.
brush,
Floss. It's flossing.
floss. There's no protocol to certain procedures, but it's not necessarily that. Maybe at your dentist, one, then you might have to question how they approach their own treatment. But when we normally see cases, there are a few things we consider from the anatomy and physiology of it, biology of the teeth, and I would recommend only go to dentists with x-rays because dental radiology is also important and the knowledge of material and oral pathology is also quite important in diagnosing and formation of the treatment plan. Obviously pharmacology as well, but we also have the aid of the pharmacist. So although we write and prescribe certain things, it's always great when the pharmacist calls you to confirm if certain things are not on their schedule and if they can change it. One I saw recently was a patient, hypertensive patient. This patient was taking something that was making her gums inflamed. She didn't know what it was, but as we know, it's most likely calcium channel blockers. So she came wanting dentures. And unfortunately, she also had periodontitis with grade 2 mobility of the teeth. And some of them were also very decayed. So with this one, the whole thing is, yes, we had to remove some of her teeth first before we started the procedure for the false teeth. But when we do this, now if she's continuously taking the current medication she's on, the calcium channel blockers, the gums would still be swollen. So hypertrophy of the gingiva was now a major concern because when we take the impression, it's not going to be
Same
accurate. Yes. So now I wrote a letter or a message to her treating physician to see if he can change it from a calcium channel blocker into maybe an antidiuretic or something that will help her out. Because I'm not sure. This was a government institution that she was going to. She said she was going to go private later on. So I'm not sure what they've got for her to take. So yes, knowledge of pharmacology is quite important. But also, if the patient can't really change the medication, now we have to think about what else we can do. And this is also where material science and dental radiology comes in. So with material science, we obviously need to know the type of impressions we need to use. Some impressions are more stable than the others, or than others. So knowing all this is something we all learn in school and learn as life goes on. But it's just nice to know, and the more you know, the better you can treat your patients.
You're such a dental nerd. But a good teacher. But a good teacher. I know.
You're so passionate.
Yeah.
So passionate
Also,
about
like,
teeth.
I was just gonna say,
Passionate about teeth.
Yeah, we just listened to the monologue. Yes.
Who's passionate about teeth?
You
You don't have to deny it. It's fine.
It's just knowing.
You're just too clever about it. Okay.
No, not luckily, but advantage to come across different things and stuff.
Yeah.
Yeah.
Totally.
I love when you look at me and you're like, I'm supposed to know what the hell she's saying.
It's like, you're my audience for now, so
Yes, Prof.
thank you.
Is that your title?
That's what he wishes. Call me in university. It was myself and two other guys,
Malalo and George.
and we were all profs to each other. But I was called Theory because I was always going around with my full bag. So
You carried your book. Your textbooks.
Yeah.
All of them.
I was not going to keep looking at my
That way the muscles.
timetable and changing.
That way, it's not lifting.
It wasn't that heavy.
Plus, we got lockers at some point in time.
I didn't use
Why didn't you use the
We
locker?
only had lockers in Prosto when we went down to the basement.
Yeah.
Well, at least that's the only time I remember. Okay. OT. Okay, so I've got the Am I the Asshole? We're just going to do one audio segment of Am I the Asshole?
Old for telling my kids my wife went to the dentist. My wife and I have kids between 11 to 15 years old. Today I took her to the dentist because she broke a tooth. She had it pulled in a fitting place. Don't know the exact term, but it's temporary until a full replacement. She's very anxious about the dentist, so I was with her, reassuring her, handling the paperwork, driving her to and from, got her pain meds and antibiotics, and I'm taking all the parenting duties for the next 2 or so days. So, what did I do wrong? I told my kids, Mom had a tooth pulled. Please let her rest this weekend. If you need anything, ask me. I knew she was, weirdly, embarrassed about an extremely common dental procedure, so I didn't mention it to anyone but the kids. While buying applesauce and microwave mashed potatoes for her, I started getting texts about how I betrayed her, how she trusted you to keep this private, on and on. I came home to her screaming at me that I was a damn a-hole. To be clear, the only people who know are the dental people, presumably the insurance people, my wife and kids, and myself. So, am I the a-hole for telling my kids my wife got her tooth pulled, instead of just Mom went to the dentist and now she's in pain? Am I the a-hole?
Just to summarize everything here, married couple, wife went to the dentist for a normal procedure.
Extraction.
So an extraction was done. You say extraction and a filling.
Extraction and I think like a temp for maybe a bridge or something.
Okay. So the tooth was removed and something basic. And he only told his children. And now the wife is upset about the fact that the kids know that her teeth or tooth, we don't know how many numbers were removed.
But she broke. It broke. She broke a tooth. She had to get an emergency.
I don't know. They seem very, very like extra. Very. Is that's it?
So
That's
the
the
husband
weekend.
is asking if he is an asshole for this.
For telling the kids.
Okay.
She's being extra.
Just being, also, why is he getting a mashed potato and applesauce? It's one tooth. Like, come on, guys.
Oh, he wants to be a loving husband. Get a soft diet.
Yeah.
One tooth?
I mean, we do say like for the first 24 hours. Soft.
Let me just add something here. Although this sounds weird, where the husband is thinking he's an asshole or not, and we think, well, no. Family should most likely understand. I've had a patient married and the partner for at least, I think it was 5 years at that time, did not know that the wife had false teeth.
How do you pull that off?
Wow.
Wait, like removable.
Removable.
How did he?
dentures.
Okay, I need to know her secret. How did she pull that off for 5 years? He didn't see like a glass of water
At
nearby.
least 5 years.
How?
So,
Wow.
Can I get?
Wow.
Can I get a little? You're gonna edit this out, maybe. Right? Did she never? Did she never give head? How did he?
Or maybe it was just always in the dark.
Oh, no, sure, you can feel like there's no teeth.
There's no teeth. It's
Or
like
that
an extra.
area up there was like, it's so cold in there. Or maybe she just had like.
She gave a head
With the dentures?
with the
Oh, she
dentures.
took it up and he just thought this was some next level softness.
So many questions. Was it like a full or like a partial?
It was partial.
Partial. Okay, I can maybe understand.
Wait. Where was it?
Front.
Oh, shit.
Yeah, some of it was real tip.
That pleasure gap.
Yeah.
Yes. No, but that's wild.
No, but that's wild.
You
So,
can see.
you can-
Yeah, because now it should be obvious.
So she never bit into an apple in front of him.
And what happens when he finds out? Because eventually.
Like, You know, some people are petty. Hey? He might just divorce her. Like, oh,
Maybe that's why she doesn't tell him.
oh, our marriage is as fake as your teeth. Built on the foundation of lies.
I remember seeing someone from primary school, and I remember him always having like great teeth. And then when I like saw him again, I was like, "Oh, your teeth like amazing smile." And then he took it out, and I was like,
He bought that smile. Madam.
"Why did you do that?"
Primary to high school.
Yeah, I was like, "Why?" He was like, "It's cool." I was like, "Okay, I think we're doing very well professionally. It's keeping up."
Oh, we're trying to, but you both are like.
I feel like we'll keep him on track, honestly. So.
Oh, we are.
Yeah, we're staying on
We
track.
are. We.
All of us as individuals and as a
okay.
unit are staying right on track.
Sure, we are.
Yeah. It's you who's distracted.
Look, I'm trying to read one.
Exactly. Why aren't you reading? Why aren't you reading?
Okay.
Focus.
Yes, let me focus.
Yes, please.
Okay, so some of the common issues or misconceptions that we normally get. One is I don't need to see a dentist unless I have a toothache. What do you say about that?
Well, as a non-dentist, right? I firmly believe that you need to go see a dentist like twice a year.
No, that's what medical aid says.
Should you go more?
Depends on your individual needs.
Well, yeah, but I mean,
At very least like once a year.
At least once a year, yeah. But then, yeah, twice a year is great and it helps. But there are some people who need it more frequently than others.
And others who don't really need like that twice a year. I mean, how many times have you actually seen a patient who has like good OHI really need a scaling like twice a year?
Yeah, but it's always, it's just different people as well. Also, diet plays a huge role. So depending on what you eat and what you get into your body, different things will affect you differently.
But
And even from the development of the teeth. So with fluorosis intake from being a child all the way to being an adult, it changes the chemistry of the teeth. So you don't necessarily need to visit a dentist as frequently as somebody who never had fluoride in their upbringing at all.
That's hard.
Yeah.
Are there people like that with all the fluoride, like water's being fluoridated and everything? How can you miss out? Even like your yogurts, your drinking yogurts, everything. Just
Even water. There are places that just have fluoridated water, but I think the bigger problem is people have.
is it for mind control?
No, it is not.
Oh God. It's one of those the water's making the freaking frogs gay type of situation.
Who put the fluoride there? The dentist? You guys go in.
Yeah. Make sure the whole guy is in there. No, fluoride does not do anything to mind control. Although there's the misconception that it closes the pineal gland, the third eye of the brain, so on and so forth. That is not.
How do you know?
Because when I was putting fluoride in there, I didn't know what I'm trying to block.
And the third eye is not there, just like how astrology doesn't exist.
Ooh, that's another.
I'm a Leo.
Alright, you're a Leo.
I'm a Leo.
Okay.
I'm a Gemini, but I don't really.
Certain people are born at certain times kind of gives you a distinctive personality. Or like, if you were born in January, then you are more prone to be a certain type of way because that's what you were
I still don't be
exposed to. Yeah.
Because I'm supposed to be a Gemini. I don't think.
I'm a big Leo energy.
Okay, number 3. I don't have any cavities, so I don't need to go to the dentist.
But this doesn't look like answer from the same question above. Yeah, you should still go. Or based on your needs.
Yeah, still go, because when we look into our mouths, we don't necessarily have x-ray vision. So although you think you don't have any cavities, when x-rays are taken, or even if it's just in between the teeth, the way the cavity breaks into the prisms of the teeth, what actually makes the teeth, it goes from narrow outside to a wide inside. So although it might look like a little dot or a black dot on the inside, it could be a massive destruction on the inside. So still go for checkups. It does help. If you don't have anything, you don't lose anything.
except medical aid.
Man, but you're paying for it already.
And this is
And it's cash. That is true.
the one thing in our cavities is that they can be transferred.
Say that again. What?
They can you can
You
pass
can
it on.
transfer a cavity.
Yeah, that's what I.
This is the same person that
Astrology.
also they thought I explained tricks on her. No.
You can't.
No.
Cavities
Just a
cannot
little
be transferred.
bacteria that and then it passes on. Like if
But that's your normal flora.
Okay, so let me try to
School.
make that. Yes. So when we got, as you said, normal flora in our mouths, so there are some specific bacteria that do cause decay. So when we have all this inside, they do break down the teeth structure by dissolving the carbohydrates, and that carbohydrate turns into glucose and some acidic compounds as well. So the tooth is going to actually need to be physically dissolved for this to happen. So it cannot move from one to another like a cold or a cough. Yeah. So it's just now, okay, now also when we talk about the Stephen's curve is just basically the pH level of teeth. The pH level of the saliva in the mouth after it is in contact with acid. So normal eating will actually help versus abnormal eating or grazing. So if you're just going to eat, then the saliva washes away the food product. It brings down or acts as a buffer to stop the high acid content. But if you're eating constantly, that constant eating will make your acid level in the mouth high enough for the destruction of the teeth structure as well. Yeah, but it is not that decay is transmitted
like an
from one person
STI.
to the other. Yeah.
It's not mono.
No.
Okay. I'm busting dental myths. Thanks to my dentist.
Thanks, huh?
Hi. Okay. Whitening toothpaste will give me a Hollywood smile overnight.
No.
No.
Like, they even give
You
you.
must use it longer than one night.
Okay, no. Toothpaste contains an abrasive. An abrasive is just going to remove the surface stains. What you need for whitening is something that will actually break down it's almost like bleaching. Like if you're going to take your clothing and go bleach the clothing, you need hydrogen peroxide.
Okay.
So the oxygen itself is going to break down the stains further. And that is what, in a nutshell, that's what actually causes the teeth to go from its color, broken down, into something whiter, not just an abrasive of the outside cleaning the teeth. So we're looking at a completely different chemistry or chemical formula going through. So it is not the same as a toothpaste.
So this whitening toothpaste is a scam.
It's not a scam. It's an advertising
Gimmick.
Yes. It does clean the teeth because it has an abrasive, but almost every toothpaste.
Cleans.
Yeah. But it's just using it as whitening because it's something that people want. Anyways, baby teeth. Oh my god, this one.
Oh, here
Baby
comes the
teeth.
orthodontist.
Pediatric dentist.
Sorry, pediatric dentist.
Baby teeth don't matter since they'll fall out anyway.
Can you explain this the other day?
Yes.
I couldn't get excited.
No, no, because this one literally is the one that most caretakers
Don't understand.
yeah, but they take this for granted because, for instance, like I brought my child here because the teeth are decayed. Follow-up statement to that is, but it's the baby tooth, right? Yeah, because if it's the baby tooth, according to them, it's fine because they've got another set coming through, so they don't have to be as serious with the baby teeth as they should be. But the baby teeth comes out on or at different stages of life, so it's there for a reason. Some of the basic things are even just speaking, so speech development. So if, for instance, the front teeth all come out prematurely, now the baby is in school, just going to paint a scenario. this little baby boy or baby girl is walking around in the house, boom, eating all them snacks, now the teeth are decayed. Oh no. Goes to a dentist somewhere. Unfortunately now the only option is to remove the teeth because it's just grossly carious, completely destroyed, needs to be removed before they should be. So now this child is talking and unfortunately now almost lisping because there's no more teeth in the mouth and the lip support is also off. So they're talking but in a way that is just free. This could now lead to when going to school, psychological problems because the child is not more speaking as their peers. That's one. Second thing now is if the child does not have the teeth present where it should be, when the adult teeth comes out when they should, they may come out in the wrong position because teeth drift. If they do not have anything opposing them, they will end up drifting. So this is why you see some kids that
Coming up gang signs.
yeah, their teeth looks like it's about to start something, and then they need to go for braces. So yes, adults' teeth matters. They basically help in guiding the position of the parent's teeth.
Baby teeth matters because it
Sorry, baby teeth matters. Yes. Oh, and this one,
BTM.
so excited.
sorry. Dentists are just out to make money,
Doesn't everyone?
recommending unnecessary treatments.
I know a few. Just about that bag.
I mean,
But wow.
no, but that's the thing, because I mean, they are out there, but
I feel like anybody in private, you can say that.
Okay, let me answer this in a way that will maybe give people who think dentists are out there to make money
You should be.
an
It's a
answer.
job.
First of all, it's a
Yes.
job. You need to make money. One.
this economy,
But then the second statement there where it says giving unnecessary treatment. No, you don't have to take the treatment offered by the dentist. You're more than welcome to go for a second opinion or a third opinion. But the priority of the dentist is to give you treatment that aids you with your main complaint. So if you're going there to say, for instance, I've got a painful tooth on the backside and it needs, I just need help, what can be done? If the dentist says, okay, you could either, there should always be options. You could leave it and be given pharmacological treatment such as pain medication and antibiotics if necessary. Option two, remove it and get some prosthesis. Option three, leave it in there and do a root canal. So these are viable options. They're not there to make money. We are there to inform you on the treatment that is tailor-made to you as an individual. So if you think a dentist is just giving unrecommended, unnecessary treatment, I'm just going to say maybe it's just not in your budget. So you can't just be judgmental because you think everybody's there to. I'm just, yeah, I mean,
such an innocent way to be like, no, I was gonna say something, but whoa.
treatment is treatment, and you might need it or you might not need it, but we're not there to make money from you. We're there to assist. And let's just call it that. Oh, and then the normal household one. I don't need to floss if I brush my teeth regularly.
Yeah, that's like saying I don't need to wipe my butt because I shower every day.
Just like a butt crack. The teeth has something in between, and you still have to clean it.
What's between your butt?
But you still need to floss because your toothbrush doesn't get in between. So you still need to get in between and clean because that's where most of the cavities hide.
Yeah. Okay, so let's see some real life stories. Do you have any real life stories from your work in terms of dentistry having an arts and science? Something you've done that has helped somebody?
I mean, the one thing that comes to mind is like we were talking about, like shade selection.
Yeah.
It goes with bleaching as well, because I think people have been lulled into this thing, like fooled into this. Oh, I want like a Hollywood white smile, and the Hollywood white smile doesn't suit everyone because it looks wrong. And sorry to say, especially those of us with a darker complexion, it would just look out of place if it's too stark white.
Yeah.
So sometimes I've had to talk some patients out of going for bleaching because the teeth were fine. They didn't need any whitening. They was just in their heads about like, no, but I want my teeth to be whiter.
True. No,
And
that's
it's
true.
not, yeah. And also, I saw a couple of getting tweens, I would say, or kids just entering tween ages, and they're going through that ugly duckling phase. And it's so sad. I don't know who, especially this one little girl. I don't know who told them this, but she was like, no, because she's in the ugly duckling phase. There was nothing wrong with her smile. She's cute as a button. And then she looked like she was on the verge of tears because apparently people have been telling her that her smile's not perfect yet. So she wanted to know if she needs braces. I was like, no, it's your teeth are fine. They're just finding their way, and they're gonna find their way perfectly. You're good. You're fine. And whoever tells you that next time, just tell them that the dentist said my smile is fine. Because I don't know. I don't know. Is it family or friends or social media? But yeah, it's just
Just to clarify, the ugly duckling phase
true.
is between the age of 11 to 13.
So it's a thing.
Yes.
Yeah, it's when
So
I
this
thought
is
you were just saying like, oh,
No.
No.
they look just a bit.
it's where the centrals and the laterals have come down, but the canines are now coming. So if the centrals are coming down straight, the laterals have come down. So when the canines are coming, they're going to hit the root tip of the laterals, which might then touch on the root of the centrals. So when that happens, it collapses from the inside and spreads the teeth out on the bottom.
Nicely.
So now you unfortunately have some teeth that looks like they're flaring out
Yeah,
because
like
the canines are pushing. But as the canines then come down, they will come down straighter, and the laterals and the central incisors will also eventually become straighter. So although it looks like your teeth are flaring out, you're just in a phase of where the central and the laterals will be straightened out when the canines erupt fully. So that's the ugly duckling phase.
Yeah. So it just looks like the teeth all over. The best way I like to describe it is when like they're biting, it looks like they're the Batman signal, the Batman thing.
Does it happen to everybody?
Yes. It's when you're losing your primary teeth or your baby teeth and your adult teeth are coming in. So it's just
In degrees.
In
Let's say
degrees.
it happens to everybody, but not everybody will show it as somebody else. It doesn't manifest the same way. Okay. So I think that's one good example. I don't have to do another one.
But now what is this?
Okay, well, this was going to also be one of those where the patient comes in. So now with this one, we see she wanted, patient comes in with teeth that looks like they can't decide if they want to be indoors or outdoors. So with these teeth, she wanted to now just extract some of them because she wanted false teeth. And I just told her, let's try something else first. Ideally, we did not want to remove only one tooth because the other issues were going to be the crest of the alveolar bone, which means if we had also made dentures, it was still going to look improper. So my whole treatment plan in the beginning was move the teeth, augment the bone, and then see if we will be able to make dentures for her.
With braces?
Start with braces.
You start with braces.
Yeah, so we can change the morphology of the bone. So we went on, and this is her.
Wow.
Yeah. So we.
Zoom in this one.
Can I think, yeah. Oops. So I think I'm just going to have to put this up. So, yeah, so we had now done all this, but we had to do it in two phases because you do not put braces in a patient's mouth that has mobile teeth. She had mobile teeth. You don't put braces in a patient's mouth that has pus being produced. She had poor oral hygiene. So she was basically going to be something that I was going to do against what the textbook says. And we managed. So currently her 2-1 was the issue where there's a little bit of swelling. I don't have the most, because this was 7th of August. She's coming only next week again. She didn't make the appointment this week, so it's next week again. So see her once every month. Last time I saw her, there was no mobility of that to 1.
Seriously.
Seriously.
And now, what grade, like what degree of mobility did you have before you started?
Um,
Was there
At
mobility level?
least almost going to 3. It was quite mobile. There was pus coming out every time I touched and pushed it.
But
I know.
you were extracting.
We were basically going. But the reason why, as I said, the reason why I still did it was because I wanted to move her bone.
Oh, yeah.
So if it had failed, we would have still been
So,
able to
yeah.
bring things forward and then do the braces. Do the false teeth.
Yeah, that makes sense.
But everything went so well. And when I showed her her previous picture, she was almost saying I'm lying, that wasn't her. But it's her.
Like,
We also
she was
have a
looking in
case
the
of
mirror
her.
all the time.
Yeah.
So what did you do? Is
She
the oral
was-
hygiene better now?
Oral hygiene is better. So I had to order an iodine-based mouthwash for her. So how I approached this was to do an open flap debridement. I normally don't do cleanings for my patient. The hygienist does it. So I opened the gingival area out. I cleaned between the teeth, placed
And
the
especially here, right?
iodine in there as well. Yeah.
Concentration.
Had to start fresh bleeding to come, because with the bleeding, we get better wound healing. There's a whole cascade in there as well. I'm not going to talk about the
Please
cascade.
don't.
Yeah. So 7th August, boom, boom. The initial treatment started when, let's see, 11 October.
That's good though.
Yeah. So, yeah.
Mm-hmm.
So this is just one of the ways how pharmacology also helps with dentistry. You need to know your work, but it's fun when you actually do know it.
Now I passed. That's
I was thinking that.
that's an important thing.
I have my
passed.
degree. My name is on it.
Exactly.
My name is
How?
on it.
Do you have any stories on how your job actually helped improve quality of life? Your job is basically to
Improve quality of life. Yeah, it's like every case.
But I can't think of like a creative one
not just one in general. I mean, you had to be creative too.
to get there.
Yeah.
Oh, it's been. Oh, I feel like on the spot. I can't think of someone specific. I can't think of someone specific. In most of my cases now that I see, like at the hospital, they don't come regularly for their follow-ups. So then I struggle to see
To
the
progress.
See this progress, yeah.
Okay. Alrighty. So closing remarks. So we just talked about how jobs this has to have some science and art behind it, and how it brings about changes. Yeah. So we will be doing more of this in time. And thanks for watching. Again, like and subscribe, and comment below for any topics you would like us to cover. And remember, be professional for as long as you can. Peace.